This is Focus with Jack Cottle.
Good evening, I'm Jack Cottle. Welcome to this month's edition of Focus. This month we are talking about men's health issues. That's because it is November, or Movember, as some like to call it now. You probably know that is the month that men around the country grow mustaches to raise awareness of men's health issues and things like mental health, prostate cancer, suicide prevention, testicular cancer, and the whole Movember thing started in Australia back in 2003, and there is an actual Movember Foundation. Three guests with us to talk about that today. Dr. Stephen Niebuhr, he is with Monument Health. Ryan Stamper, a licensed counselor with Behavior Management Systems. And Roger Gallimore, he's the executive director of the YMCA of Rapid City. We're going to start with Dr. Niebuhr, a specialist in internal medicine over at Monument Health and part of starting a new lifestyle medical clinic there. From a medical perspective, when you think about men's health, as a doctor, what first comes in mind for you?
The first thing I think was maybe a little resistance to health. I see a lot of men that haven't been to a doctor in years, sometimes even decades. So I think just getting men into the office to talk about it is a good first step.
What is the challenge? Why is it so tough for men to go and get checked out, see if they got a problem?
I don't know. I think we're just kind of raised to be maybe tougher and to neglect how we feel sometimes. Maybe it's an emotional thing. Maybe it's just not accepting what's going on sometimes and thinking, oh, I've got work to do or I've got a family to support, and maybe not putting ourselves first when we sometimes need to. And they say sometimes women go through more testing and deal more with the medical field than men do, so that could be a factor as well.
And how important is it to do that, to overcome that stigma or whatever you want to say it is, to get in there and get to the doctor?
Well, obviously I think it's pretty important to get to the doctor. But it really is. It's important to get your health checked out and to go over wellness with your doctor and to get some blood work done sometimes and address any concerns or issues.
Now, one of the things, or two of the things that most commonly come to mind when we talk about men's health is the prostate cancer, the testicular cancer. How common are those issues, and what are some of the risk factors involved in those conditions?
Well, one risk is having those parts, obviously. Prostate cancer is more common than testicular cancer. It's not the most common cancer. We still see colon cancer more often, lung cancer more often, and even skin cancer more often. But it's up there. It's something that we do discuss in the office pretty regularly. Testicular cancer is much less common, actually, but still obviously something to be concerned about.
At what point do men start to need to be concerned about those kind of things?
Prostate, we generally get concerned around mid-50s for men. If you have a family history with earlier prostate cancer, then certainly we address it earlier. But for the man with no family history, no risk factors, no symptoms, generally we start having that conversation around mid-50s.
And what are some of the health issues for men that people don't think about, that they should think about?
Well, the number one killer for both men and women is heart disease. So that takes up a lot of time in the office talking about good heart health.
And so how do you prevent that? What are the steps as far as your lifestyle now that can help keep that away?
Yeah, that's a great question. So if you smoke, the biggest thing is to not smoke, really for any health issue. I kind of joke around with my patients, and it's not even really a joke, but on the medical exams, if you ever see one of the choices as quit smoking, that's always the answer. No, it doesn't matter what the question is. If one of the answers is quit smoking, you choose that one. That's the answer. So we try to get people to quit smoking. And then, of course, diet and exercise are two really important factors as well.
Now, you are in the process of starting up a lifestyle medical clinic. What's the idea behind that?
Well, so lifestyle really means things that we have control over. So to put it in other terms, such things like genetic disorders, we don't really have much control over. Your lab results, your blood pressure, we have some kind of indirect control over those. But what we mean when we say lifestyle is really what are you eating? What are you putting in your body? What are you doing about exercise? How are you handling stress? How are you handling sleep? And so it's really looking at those kind of factors. And the disease is caused by maybe not doing enough or not doing the right things with those factors. So things that can be caused by poor diet, lack of exercise, instead of prescribing medication to fix them, we're prescribing lifestyle changes. So if your diet is really not very good for you, it's leading to heart disease, it's causing cholesterol buildup, maybe the answer is not a medication to lower your cholesterol. Maybe it's looking at your diet and saying, hey, this is not really ideal for you. So let's try to work on something that is.
How often do people have a diet that you talk to them and think, oh my God, that's what you're eating every day?
Yeah, well, that's like the silent voice in my head saying that, but it's pretty common. The standard American diet, as we call it, is not really a good one. If you could get everybody to eat their 5 servings a day of fruits and vegetables, to avoid processed foods, junk foods, really things that are making us sick from eating them, you would do a world of difference in a majority of patients, and you would save the healthcare system billions of dollars, in fact.
Are there myths out there? Are there things that people believe about health, the men's health in particular, that are simply not true, that you hear a lot of?
So there's quite a few of them. I think one common one I see pretty regularly is in people who would like to lose weight, and they tell me, I'm going to start walking. And that's great. I totally support it. Walking is great. It gets people out, gets people moving, but it's not really a means to lose a significant amount of weight. Change really needs to start with the diet. And one example I use is if you're going to buy sweets at the grocery store and think, oh, I'll just walk it off, that's pretty tough to do. So one cookie or one sweet could be 100, 200, 300 calories, and you might have to walk several miles to burn that off. So if the choice is between walking a few miles versus opting for something healthier, you're going to do much better opting for a healthier option.
How important is this as you age? If maybe you can't get away with what you did when you were 20, when you're 40, 50, 60 years old?
Yeah, I love that question. So I think of health like an investment. I just told a patient, I think yesterday, it doesn't start when you don't start investing in your health when you develop problems. That would be like saying, well, I'm going to retire next week, let me start saving money. It doesn't work that way. You have to start saving early on, and the same goes for your health. You need to start investing in your health really as a child to have the best chances for success. But really, today is the best day for everybody to start if you haven't started already. There's no better time than the present. So making the right choices for diet, for exercise, for quitting smoking, for not drinking excessive amounts of alcohol, for mental health, today is always the best day. So start now.
All right, we are out of time. Dr. Stephen Nieboer, thank you for coming up.
All right.
We'll continue our look at men's health with mental health when we come back with this month's edition of Focus. I'm Jack Cotta. Welcome back to this month's edition of Focus, talking about Movember, or November, which is the month that we recognize some of the issues with men's health. Jason Stamper is a licensed counselor at Behavior Management Systems, joining us now. Thank you for coming up. We talked about the medical and physical sides of men's health. How important is it to tend to the mental health side of all of this?
I think it's phenomenally important to attend to the mental health side of things. I think so many times men in this culture, we tend to be told or taught that we need to just bury our emotions. We need to ignore what we're feeling inside and just dig in and do our work. And unfortunately, in today's environment, with all the extra stressors, all the different things we've got going on, that just doesn't serve us well always all the way through. So I think it's very important to reach out and find the help that you need to take care of your mental health.
So how do you overcome that barrier? How do you get men to realize that maybe I do have an issue, maybe I do need to go talk to somebody?
Phenomenal sales job. So no, I think one of the biggest things is we see a lot of men that are coming later in life. I think when they've tried a lot of different things, they come in and they want some help that way. But I think to overcome it, I think part of it is just conversations and getting to know someone. Having people around that you can trust, to rely on, to say, hey, it's okay to go do this. I think so many of the men that I come across, it seems to be counterintuitive, but they don't think it's brave or courageous to be able to step up. And I think men in general, maybe not, but they don't think of talking about their emotions. They don't think about talking about the things that are impacting them internally is a brave or courageous thing to do. And I think it's absolutely courageous to be able to step up and say, hey, I need some help. A coach a long time ago told me one time, he said, we can't always get there on our own, because if we could do that already, we'd already be there. And so sometimes it's okay to admit that we need to step back and we need to get a little help, and we need to figure out how to change the way we've been going about looking at life and change the way we think about things in life.
So what are the most common mental health issues that we see in men?
I think as men get older, one of the things that we see are relationships, relational issues, whether it's with their partner, with their kids, or whatnot. We do see some depression and anxiety, but a lot of times men are pressured by their spouse, by their partner, that things aren't going well, and so they need to go get some help. And so those are some of the things we see. We see men that struggle with substance abuse at times, because substance abuse has become one of these things. Alcohol is legal, right? And it is something that, a lot of people say, well, alcohol doesn't work to fix problems. Well, unfortunately it does. We take a drink of beer, we have a couple beers, we're starting to feel a little okay. We drink a few more beers, we feel a little numb. And that's just covering up what's going on. And so we see men that have had their partners pressure them and say, hey, we need to get you some help. We need to get you in and work with these things instead of dealing with it through other means that aren't effective. Some men are workaholics, and so they focus all their energy and effort on work, and then sometimes later in life when kids leave the home, it's you and the spouse. And so there's not that distraction there. There's not the other things going on. And so that's when some of that stuff comes out.
You talk about stresses. How has the pandemic played into that? Now, that's a lot of additional stress for some people, financial, jobs, stuck at home for
Absolutely.
a long time. How much has that played into some of the things that you're seeing?
I think it's playing in quite a bit. The job loss has been a big one. I mean, when you've got people who have to sit at home, work gives us a sense of purpose. It gives us a sense of well-being, to be able to go to work, to be able to do something productive. And when you take that away from someone, that's hard. I don't care who you are. And so that has led to being stuck at home, not having these things go out. The other part of it, you mentioned financial stress. Absolutely. If you lose your job, you lose your health care. If you lose your health care, if you're the one who's bringing that home, you no longer have health care for your family, potentially. So I think that brings in a lot of different stress. We've definitely seen people who have gone from having a decent job to not having any job and having to figure out how to navigate different resources. How can they go feed their children? How can they go feed their families? How can they make sure that their health care is taken care of? All of those different things we've seen throughout this process.
Now, the suicide rate for men is nearly 4 times what it is for women. Why is that, and how do you combat that?
The why about that question, I'm not 100% sure. My best guess is that because men can be a little more impulsive, and they're not afraid to do things like use a gun, not afraid to go jump, not necessarily not afraid to go jump off, but go do something more drastic. A lot of times the research and the things that I've read are women a lot of times use medications and pills, and sometimes that doesn't always work as effectively. So there's some of that conversation out there. As far as taking care of that, suicide is one of these things that as you get into that place where suicide starts to become an option to deal with the problems that you have in your life, it becomes this only option. And so even though we can look at somebody who's suicidal and go, well, you've got this and you've got this and you've got this, when you're in that place where life is so hopeless and it doesn't seem that you've got any other choices, that suicide becomes a problem-solving method. I don't want to feel like this. I don't want to be like this. I'm embarrassed. I'm ashamed. All of these things, suicide becomes the one way to solve that problem. And so what we have to do is when we work with clients who are suicidal, we have to help them begin to understand that suicide is a solution, but it's not the only solution. There are so many other ways that we can help clients learn how to solve problems, learn how to approach life difficulties differently, that we can help them resolve some of that suicidality, overcome some of that. And we've seen some great success in working with people and partnering with people to help them get to that place where, suicide may linger in the background, but it's not the only solution.
So what's available? If somebody feels like I may have a problem, I need to talk to somebody, what help is available out here for them?
There's actually lots of help. So the agency I work for, Behavior Management Systems, we've got outpatient counseling regularly and consistently over at our Elk Street office at 350 Elk Street. Rapid City, we've partnered well with Rapid City and the county. Crisis Care Center downtown. is a great resource for anybody to use. We've got clinicians on staff 24/7, 365. So if you're struggling with something, there's always somebody that you can reach out to. You can pick up the phone, you can give them a call, you can go down to the care campus downtown, and you can ask to go into crisis care. You can go there. Sometimes we talk to our clients, go there and take a time out. If things are really that bad, there are people there that are willing to help all the time. And that goes for Rapid City. I know we've got people up in Spearfish that leverage the Crisis Care Center as well. And there's a smattering of other agencies around as well. There's options out there. We don't want you to think that you're alone in this process. We want you to know that there are people here who are willing, able and capable to help you through whatever it is that you're going through. It's going to take some time, but we've got the time to put in and we're willing to do that.
All right, Jason Stamper, we're out of time. Thank you very much for coming up. We'll continue our look at men's health with general wellness and keeping yourself physically fit. That's coming up with this month's edition of Focus. I'm Jack Cotto. Welcome back to this month's edition of Focus. This month we're talking about Movember, one of the month dedicated to raising awareness of men's health issues. Earlier we talked about medical, we talked about mental health. Roger Gallimore is the CEO of the YMCA of Rapid City. Again, we talked about medical and mental health as a perspective. How much does general wellness, staying in shape, keeping active, how much does that play into this whole men's health picture?
You know, that's a key part as well. And you're right, you hit the mental health, and that's great, the internal medicine side. You know, the general activity and health and wellness of the individual is critical as well.
And so as you look at that, everybody capable of different things. How do you go out there and find out what you're capable of and what you can do and what's the right thing for you to do?
Mm-hmm. Yeah. You know, your body's going to tell you. And whether it's learning how to just go for a walk, and your body's capable of doing so, that's great. Good starting point. Go for it. You don't have to enter into a Rocky style of training regimen to get the benefit of good exercise. So it could be an actual exercise regimen, or it could be, your regimen could be going for a walk or a bike ride, or it could be just getting on the floor and playing with the kids. But whatever it is, in this time of constant engagement with the screen, whether it's on the laptop, the computer, the notepad, or whatever, you just got to get out there and move.
What are the mental benefits of doing that as well? Obviously, there's a physical benefits to getting out there and exercising, but what about for the mind? What does that do you for getting out there and getting out and doing those kind of things?
You know, there's a lot that's been said about endorphins, and it's real. You know, when you expend that energy, then it does release the endorphins, and it is something that builds that sense of wellness, that sense of well-being. So it is very important.
How does all of that change as we age, and you've got little kids down there to pretty old senior citizens down there? How does those needs change as you go through the years?
You know, you adapt yourself at different age levels. But you know, I would take it. I would take it like a vehicle. You know, you get a brand new car, and you take the brand new car, and then you go out and you park it and don't move it ever again. And what happens is then it starts corroding, it starts rusting. The engine might or might not turn over at some point in the future. It's got to run, and it's like that with your body. It's got to run. Otherwise, then all that large muscle mass that we men enjoy starts going the other direction. And so it's very important for us to keep our bodies moving.
Now, I have seen some of our senior citizens here in town that have remained active for well into their 80s, and you look at them and thinking, that's amazing, that's what keeps them going. How much of that do you see? Is that somebody, even as they age, that keeps them going for another 10 years, another 15 years, another 20 years?
Yeah, I couldn't have said it better myself. In fact, I could just rattle off all sorts of people that come to mind who, as they've gotten older, they've just continued their exercise. They may have backed off a little bit, but it's still very important part of their day, important part of their routine, and it really helps to maintain that core structure, maintain the balance, maintain your bone density, all those things as you age.
Now, you've been at this a long time. You said you've been down at the Y for 42 years now?
Yeah, a lot of years.
A lot of years.
Yeah.
How has that changed? How has the attitude towards fitness and wellness changed and evolved over that period of time?
Yeah, that's a really good question. You know, I think people have recognized over the last couple generations the need for exercise, and yet at the same time, we've had a competitor, so to speak. And again, I go right back to screen time. The whole business about screen time has almost become a mind-numbing drug that has kept people away from movement. So I think the knowledge is out there that we have to move, we have to exercise in whatever fashion. And so this is really just the encouragement that even under this pandemic, or especially under this pandemic, we really have to build exercise into our day.
Talking about that screen time, it wasn't that long ago that you would see kids were outside running around all day long, where now some of those kids are not getting outside because they're in there playing games. How much of that do you see in kids, and how important is that for kids to keep moving?
Yeah, there are lots of opportunities for kids to move, and we do see kids that way, but we also see a generation of kids who don't get outside and play. And so again, the appeal is to make sure that children are playing. You know, there are different movements, whether it's through NFL or other organizations. The 60 minutes of play a day is very important. And you're right, you and I, Jack, I mean, we're from a generation that it was get outside and don't even go back until you get called for supper. We've got to instill that into our kids. Again, playtime, and not in front of a screen. Get out there and move.
How about the pandemic? How hard has that hit you guys down at the Y, and how much has that changed everything, the way you do things now?
Yeah, well, it's changed a lot. You know, gone are the days of just simply coming in and doing things, and we've taken a lot of different steps, from screening people when you come in to the disinfecting process for all of the cardio and strength training equipment that people have adapted to quite well, even in the locker rooms and all the disinfecting processes that go through. So all of which, you know, has added staff and everything, but really what it's done is it has created an even safer and more clean environment.
Are you seeing people that are anxious to get out and do something, that have been trapped at home, fearful, and maybe not fearful, but wary of going out and mixing with people? Are you seeing that easing a little bit, or people just anxious to get going?
You know, it's little by little. People are coming out. Understandably so, people are wary. And more each week we see just a few more people coming back and saying, I think I'm ready to get back into things again. But there's still a sense of concern that's out there, and again, very understandable. You know, the whole approach that we've taken through all of this is being responsible yet reasonable. So we want to make sure we do the right thing, but we don't want to shut everything down in doing so.
All right, we are out of time. Roger Gallagher, we want to thank you for joining us. We want to thank our other guests earlier on, Dr. Stephen Niebuhr from Monument Health and Jason Stamper from Behavior Management Systems. If you want more information, we said it is Movember. The foundation, us.movember.com. So again, thank you for joining us for this month's edition of Focus. Hope to see you again the first Sunday night of next month. Good night.